Good evening. You are tuning into AWANI Tonight with me, Farhana Sheh. How do we better educate our children on sexual education? And celebrating World Immunization Week, we discuss the importance of vaccines in saving lives. That's coming up. The special National Security Council meeting scheduled for Monday next week will decide on several matters related to Aidilfitri celebrations this year. These include the standard operating procedures and inter-district travel permissions. Senior Minister Datuk Seri Ismail Sabri Yaakob said Aidilfitri SOPs will be issued based on the advice and recommendations from the Ministry of Health to curb the spread of COVID-19. Today, the Technical Committee meets to iron out details to be presented next Monday during the NSC meeting, chaired by the Prime Minister Tan Sri Muhyiddin Yassin. Senior Works Minister Datuk Sri Fadilah Yusof announced that the government has agreed to postpone the increase in toll rates for 3 major highways, which was supposed to take effect on January 1st this year. He said the Cabinet made the decision on Wednesday in view of the rising cost of living due to the COVID-19 pandemic. Fadilah said the hike in toll prices was supposed to affect the Shah Alam Expressway, Kesas, South Klang Valley Expressway, SKVE, and East Coast Expressway 2, LPT2. Fadilah added another 21 highways for all vehicle classes and 1 toll plaza would also see a freeze in toll rates, and this would include the North-South Highway, plus Duta Ulu Kelang Expressway, Duke, Damansara Puchong Highway, LDP, and KL Putrajaya Highway, Max. He said the postponement would cost the government 2.25 billion ringgit and the negotiations to restructure toll rate with the concessionaries were ongoing, adding that this would be finalized before 2023. Deputy Inspector General of Police Datuk Seri Akril Sani Abdullah Sani has been appointed as the new Inspector General of Police effective May 4th. Akril Sani's appointment as the 13th IGP is to succeed Tan Sri Abdul Hamid Badur, whose contract expires on May 3rd. Home Minister Datuk Seri Hamzah Zainuddin said the Yang di-Pertuan Agong has consented to the appointment on the advice of the Prime Minister following a recommendation by the Police Commission. Hamzah said Akril Sani will serve as IGP until October 3rd, 2021, when his term of service with the police force ends. Akril Sani, who will be 60 this year, holds a Master of Science in Management degree from University Utara Malaysia. He started his service in the force on February 2nd, 1986 as a Cadet Assistant Superintendent of Police. He has held various positions at district and state levels and at Bukit Aman headquarters. Among the positions he held were as Sarawak Police Commissioner, Perak Police Chief, Crime Prevention and Community Safety Department Director, Commercial Crime Investigation Department Director, and Strategic Resources and Technology Department Director. The topic of sexual health is often treated as a taboo in Malaysia. Therefore, those who lack proper understanding would trivialize or even joke about the topic, says Voice of Children's Sharmila Sekaran. So, what is the best way for students, teachers and parents to properly educate themselves to get a better understanding of this matter?
Basically, you have to choose the right person and ensure that they're equipped with the right language and right knowledge to teach this topic. They cannot be embarrassed about utilizing very, very important words and calling a spade a spade. So, don't use nomenclature for different words and body parts. They need to be able to address this in a very sensitive manner, but in a direct manner, and be able to handle questions from both boys and girls. So that's the first thing, how are teachers being taught to teach? The second thing we need to look at is the entire education process and the syllabus of teaching. Is it geared towards the students and their needs? We also have to remember that children are getting a lot of information online from social media. So teachers and the educators need to know what information is out there, how their students are getting this information and processing the information, and address it within the classroom as well. Matters like this can actually also be addressed through making it easier for children to access, for example, clinics, healthcare clinics, places like that, where they don't necessarily need a letter from their parents or their guardian's permission, but where that person, a nurse or a doctor, is able to teach and talk to a child about the whole sexual reproductive health in a kind of like more scientific and medical aspect, but totally understanding the child and where the child is coming from, and the kind of information the child seeks to know and understand.
Sharmila said it is also important for parents from all backgrounds of the society to come together and equip themselves with correct information so that they can communicate with their respective children. Today is the last day of World Immunisation Week. Celebrated every year in the last week of April, the day aims to promote the use of vaccines to protect people of all ages against diseases. With the theme Vaccines Bring Us Closer, we speak to Dr. T. Kok Keng, Senior Lecturer at the Department of Medical Microbiology, University of Malaya, on the importance of vaccines and how they can save lives.
A vaccine is very important because it is one of the different methods to actually produce immunity to a certain disease by stimulating the production of antibodies. One of the best examples I could think of is the polio vaccine, which is a vaccine against polio virus that can cause poliomyelitis. Maybe some of us, especially the younger generation, may have not heard about this disease simply because the disease has been successfully eradicated by vaccination many years ago. So in many developed countries nowadays, polio disease is no longer existing. And this shows how promising and how effective a vaccine is in eradicating a viral disease.
Dr. T debunks the misconceptions surrounding the safety of vaccines and urges for everyone to do the right thing and get vaccinated.
There are many misconceptions, unfortunately, towards vaccination and the vaccine itself. I think one of the most common misconceptions is probably the fact that vaccine is not safe. People are afraid that vaccine can actually elicit certain unwanted immunological responses in our bodies. Yes, this can happen, but the percentage or the incidence is actually extremely rare. If you take the recent reports on the AstraZeneca vaccine, in which only 4 in 1 million who have been vaccinated reported complications, hematological complications post-vaccination. And these numbers, 4 in 1 million, actually reminds me of the side effects caused by the polio vaccine, for example. Many years ago, the reported incidence of side effects is also around about 4 in 1 million. So, but if you look at what we have today, I mean, we no longer have polio because the disease has been eradicated. So this shows that the so-called adverse effects caused by the vaccines, the benefits of the vaccine actually outweigh the complications or the minor adverse effects caused by the vaccine. Education is a form of empowerment in order to enlighten ourselves of the importance of vaccination. And given the current situation, which is really alarming, I think we all have to get the right information and take the necessary actions to do what is right for ourselves, for our family, or even for our country.
We'll take a short break. Stay with us.
Induknya adalah Melayu.
Balik kepada support system. This is orang yang membuat polisi.
Kalau itu yang dikehendaki, fine. Mungkin kita berbeza pandangan.
Tapi kita mempunyai kuasa yang boleh menentukan budaya di masa hadapan.
Polisi yang mesra wanita sudah tentu dia akan datang daripada pemimpin wanita.
Welcome back. On to the international front. A new COVID-19 cluster was detected in Singapore's largest hospital. This as the country reported the highest number of daily local cases in 7 months.
Singapore Health Ministry reported 16 local transmissions yesterday, 8 of those linked to Tan Tock Seng Hospital. The cases involved a doctor and a nurse who were both vaccinated against the virus, yet both showed symptoms. Authorities isolated 2 wards in the hospital and are currently conducting contact tracing on staff and patients. while quarantine and movement curbs were increased after the cluster was detected. The Republic reported 61,000 COVID-19 cases and 30 deaths since the beginning of the pandemic, with a vast majority of those in dormitories housing foreign workers.
India set another world record for coronavirus cases Friday, registering over 380,000 infections in the past 24 hours. The country's caseload has now reached 18.7 million, while overall fatalities have risen to more than 200,000, including 3,498 deaths.
India has been witnessing an exponential rise in infections. Since April 22nd, the country has been registering over 300,000 daily cases, which has brought the country's health system to near collapse, resulting in an acute shortage of beds, oxygen and treatment drugs. Along with the rising number of cases, the number of daily fatalities has witnessed a massive increase across the country. The capital, New Delhi, which has been reporting a huge shortage of oxygen at hospitals for several days, late Thursday again reported its highest ever number of fatalities on a single day due to the coronavirus. The rising deaths have also strained crematoriums and burial centers. The Ministry of Home Affairs issued orders to all states and union territories on Thursday to implement the necessary containment measures to curb the spread of the infection.
Thousands of ethnic Karen villagers in Myanmar plan to flee to neighbouring Thailand if fighting between the Myanmar army and Karen rebels intensifies. Clashes of the insurgents escalated after the military junta took power and ousted elected government led by Aung San Suu Kyi. Over 2,000 civilians had crossed into Thailand as of early Friday since the latest round of conflict began, according to Thai officials. Meanwhile, the United Nations Development Programme warned that half of the country's population risks going into poverty in 2022. This is due to the impacts of both the COVID-19 pandemic and the current political crisis triggered by the military coup that resulted in some 750 people killed. The European Union said on Friday that it is ready to offer support to Myanmar to assist in the crisis in order to restore democracy in the country. At least 44 were crushed to death at a religious bonfire festival in Israel. Tens of thousands of Jews defied coronavirus restrictions and marched towards the Mount Meron tomb for the annual Labomeh commemorations. According to medics, 103 people were injured in the stampede, with casualties including children. The Mount Meron tomb is considered to be one of the holiest sites in the Jewish world, and it is an annual pilgrimage site. The event was one of the largest gatherings in Israel since the COVID-19 pandemic started more than a year ago. Private bonfires at Mount Meron were banned last year due to coronavirus restrictions, but lockdown measures were eased this year. What can the rest of Malaysia learn from Sabah politics over its last election? Tonight on Consider This, we speak to 3 co-editors of the recently launched Sabah from the Ground, the 2020 elections and the politics of survival. That is all we have for you on AWANI tonight. Get the latest news update on COVID-19 and COVID-19 vaccines from astroawani.com and Astro AWANI app. I'm Farhana Sheikh. We'll see you next week.